All right. Can you introduce yourself with the tape?
Yeah, my name is Dr. Zachary Rubin. I'm a double board certified pediatric allergist in the western suburbs of Chicago. I'm in private practice and I'm on social media educating the masses about allergies, infectious diseases, and public health. I'm excited that I'm having a book coming out called All About Allergies. And I want people to know more about allergies because it's one of the most common chronic diseases in the United States and abroad. It's growing at an alarming rate, and we need to take this more seriously.
Well, I really appreciate it. And it actually happens to be the case that we'd like to know all about allergies today. So I want to start there. What is an allergy?
An allergy is simply an abnormal immune response to a foreign substance. That's different than, let's say, rheumatology, which deals with autoimmune diseases. So the immune system is constantly surveilling to see what are the foreign objects out there that could cause harm, cause an infection, like viruses and bacteria. And so we try to protect ourselves from those foreign invaders. With autoimmune disease, you accidentally have this immune response against your own healthy tissue, like in lupus, as an example. With allergy, it's this immune response that happens to things in the environment that we would think would be benign, like food, as an example. We need food to sustain life, but how does our immune system know that food is safe to consume? And for some people, basically the immune system thinks that food is a parasite and creates this potentially life-threatening reaction that's often referred to as anaphylaxis, or it could be something like pollen, dust, pet dander that can cause a lot of irritating symptoms and increase the risk of having a whole host of other issues. And so allergy presents in many different ways, all related to how the immune system is responding to those foreign substances.
Because we're nerdy on this podcast, it seems to me, and I, obviously went to medical school, so spent some time learning, or just say more time than the average person learning about how your body responds to these things. And, the simple approach that I've always had is body sees something completely normal and then freaks out. So think like dog sees a delivery man and goes nuts. And you're like, the delivery man is just here to deliver, not really doing anything bad. In fact, maybe doing something good. And you are treating this like a foreign intruder. And there are a lot of different reasons why an immune system could freak out. What do we know about why our immune systems do this?
Well, it depends on the substance that we're talking about, and this is an evolving field. So one of the examples I like to give people is seasonal allergies. One of the reasons why we are seeing more people suffering from it and why you'll hear people say this is the worst year it's ever been is because of the types of exposure and how long we're being exposed to that foreign substance. So your immune system operates differently in different parts of the body. So if you inhale something or you ingest something, there's different aspects of the immune system that do that. And so with seasonal allergies, which is mainly driven by pollen grains released from trees in the spring, grass in the summer, and ragweed and other weed-related plants in the late summer and into the first frost of the fall, you are exposed to millions upon millions of these pollen grains. And what we've seen over time is the temperatures have been rising. And with rising temperatures mean that the plants start releasing pollen earlier in the year, and then they stop pollinating later in the year. So you have a longer period of pollination. The number of pollen grains have been increasing too because carbon dioxide is being released into the atmosphere through burning greenhouse gas emissions. So that's like basically plant food, part of the photosynthesis. And there's been elegant studies where they literally put trees into these special warehouses that are controlled by how much carbon dioxide they're exposed to. So when they expose those plants to higher levels of carbon dioxide, more pollen grains are being released. And we're also seeing some changes in the actual structure of the pollen grains in some cases, like with ragweed, where the immune system may latch onto that foreign substance and create a more robust and more severe allergic reaction that can create a lot of symptoms. So as much as people don't like to hear the term climate change, it is a real phenomenon when we see that we are literally dumping carbon dioxide into the atmosphere. The temperatures have been rising. That's creating the immune system's kind of irritation in an indirect way to lead to more people suffering from seasonal allergies.
This may be the key to getting people to care about climate change. It's like, listen, existential doom, terrible. They're like, nah. We're like, seasonal allergies? And they're like, okay, no, listen, this
no,
has
we got to take
stop.
this seriously. Yeah.
This has to end.
Yeah. I mean, there was a study that came out recently, about a year or two ago, where they looked at what is the pollen counts and what is the pollen season going to look like in the future, in our kids' lifetime. And in the year 2100, they predict that we're going to have anywhere between 30 to 90 days more pollen season than it is now, which is just really, really troublesome.
That's wild. I want to get to the broader implications of that in a minute, but I also want to talk a little bit about the biology here, because one of the things that there's some evidence to demonstrate, and certainly feels true, is that there's just more allergies happening out in the world. What do we understand about why that's happening?
Right. So there's also some genetic components that we're learning about more and more. So a lot of children develop eczema, and eczema is kind of this gateway to developing other allergic diseases. It's often called the atopic march. So once you have eczema, you're at higher risk of developing allergic rhinitis, asthma, and food allergies typically. And so what we have started to learn more and more is that the disruption in the skin barrier is kind of a gateway towards a process called sensitization, where your immune system starts creating these antibodies called immunoglobulin E, or IgE. It's a subclass of antibodies normally involved in preventing parasitic infections, but in a lot of developed countries, we don't see parasitic infections as much. So the immune system starts creating havoc in other ways by creating these antibodies to food or to latex or to pollen, right? And that's a process where you're primed to eventually become allergic after subsequent exposure. So not all allergic reactions act this way, but one of the most common ways is through this, what we call type 1 hypersensitivity reaction. And that often starts with eczema. So there may be some environmental factors and genetic predisposition where you develop this skin disease, then your skin is being exposed to these foreign substances, the immune system becomes sensitized, and then later on becomes allergic.
What do you make of this like cleanliness hypothesis, right? That fewer of us are spending time, or at least maybe not us, that you and I seem to be about similar age, that like our generation was the last generation that spent like a lot of our time outside,
Right.
getting exposed to all kinds of different things in the dirt, in the grime, and animals and all of it. And then this generation, our children, are spending a lot less time out of doors. And there's some evidence around children who grew up on farms and their risk of allergies. What do you make of the cleanliness hypothesis? Both, how do you think about that, and then what does that mean about sort of what the intervention ought to be if we want to protect our kids from these kinds of allergies?
Right. So that's a fascinating question, and one that a lot of people are trying to tackle. So the original idea is called the hygiene hypothesis. This idea that if you are too clean, so to speak, your immune system's not being challenged enough to basically prevent allergic or autoimmune diseases. But there's certain nuances to this hypothesis that don't quite make sense, because we know that there are certain types of infections, certain pathogens, microbes that actually can increase your risk of developing allergic diseases and autoimmune diseases. Classic examples are rhinovirus and RSV, which increase your risk of developing asthma if you have that early in life. We're starting to learn emerging evidence that COVID-19, SARS-CoV-2, the virus that causes that disease, can potentially increase the risk of developing autoimmune disease. We're seeing more people with autoantibodies towards these things. So keeping clean is important to prevent pathogenic infections. So that part of the hypothesis is somewhat flawed. But there's a newer type of hypothesis called the old friends hypothesis, or old friends theory, where there are certain commensal organisms that are a part of our microbiome, the environment, whether it's on our skin or in our gut, right, that coexist with us in a positive way to help regulate our immune system and don't cause pathogenic disease where you get very sick. And that's the type of issue where you're outside, you're playing in the dirt, and there's a lot of organisms that can potentially be beneficial. And some of the studies we've seen is that, let's say we compare populations of kids who were born to mothers who came from C-section or a normal spontaneous vaginal delivery, and we find that those who are born by C-section, there's an association with having more allergic diseases. And that might be because they're not being born through the birth canal, they're not getting exposed to some of those commensal bacteria. Therefore, their gut microbiome, that's the environment in the gut, is not necessarily the same. So there are certain exposures early in life that can be important, but it's not to tell people, oh yeah, it's important to build your immune system by getting sick. That's not actually beneficial. So there's a nuance there that people need to understand, that yes, it's important for certain types of exposures, like we see associations with pets early in life can potentially reduce the risk of developing a pet allergy. Those early exposures are potentially healthy, but not to say, oh, there's chicken pox in the neighborhood, go get a pox party, or with this measles outbreak that's been occurring, let's have measles parties. Those are bad ideas.
Yeah, I really appreciate that nuance, right? So I want to sort of break down a couple of pieces that you talked about here. The reason that your exposure to the world may decrease your probability of having allergies is not because you get sick from it. It's because the normal bacteria and other exposures that you get from being a little bit dirty can actually help protect you over time. The other interesting piece here is that, part of this idea of hygiene is that we're constantly washing away these bacteria all the time, right? And that is, while I am a big fan of washing hands and staying clean, the degree to which we do it, right, when you're like shampooing your hair every day or you're washing your face every day, we had a really interesting conversation with actually a physician writer named James Hamblin, and he just decided not to shower for a while. And his note was basically that, your body's evolved a lot of ways to live in symbiosis with these microfauna that are out there in the world. And when we wash that away, we may be doing ourselves a disservice. That's one piece of it. The other interesting thing, to the point about like folks who grow up on farms and in rural areas, is that, we're focused on the farm part, and what we're not focused is on the rural part. And the rural part means that the probability of being exposed to the kinds of infectious diseases that tend to spread a lot faster in density, like in cities, that part may actually be part of what mediates this observation that folks who grew up in these contexts may have lower probability of allergies over time. And so, there's something about protecting yourself from the exposure to these illnesses that also comes with being somebody who tills the land. That is a classic confounder in the way that we think about this.
Exactly. And, you bring up a good point about bathing, because with my patients with eczema, I often tell them to not use soap every day, that you might use soap a few times a week or to really dirty areas, because you use soap, yes, to clean and stay with good hygiene, but it actually strips away some of the healthy skin barrier. So I often tell people to, yes, sit in a tub for 10 to 15 minutes to absorb that moisture, especially when it's dry out. And then if you need medication, you put it on afterwards after you pat dry, and then put on moisturizer to lock it in. A lot of people have this misconception that, oh, I shouldn't bathe at all and just put on moisturizer. Where's the water going to come from in a dry climate, right? So it kind of lends to that point where if we strip away some of that area, you end up irritating the skin more. And so we have to find a way to balance out maintaining a cleanly body, make sure that you smell right, not being exposed to certain chemicals, but at the same time, we want to balance that immune system out.
Yeah, I appreciate that advice. And, we're obviously in the thick of allergy season. A lot of folks out there struggling right now. Obviously, you're not going to give clinical advice on a podcast, but what do you think of as the general guideline for how folks should think about managing their allergies? What is, allergies that you can manage by just trying to avoid exposure versus allergies that should be managed by something over the counter versus you need to go see a doctor?
Right. So I have a few kind of tenets that I talk about with my patients and I talk about on social media and in interviews like this, which is the first thing you got to do is identify what you're actually sensitive to, because there are a lot of things in the environment that can cause problems. You may think it's pollen, but maybe it's also your animal, or it could be kind of an issue with both where your animal goes outside and brings stuff into the house, right? So you have to think about all those potential points of entry, and allergy testing, whether that's through your primary care or an allergist, can be helpful in identifying that. So once you have that, you can find ways to reduce exposure. Since there is this idea of a symptom threshold where your immune system can tolerate a certain amount, and that varies from person to person. But if you have multiple exposures at the same time, then it's almost as if like your cup of the immune system runneth over and creates symptoms. So if you can at least take away one of those exposures, it might actually help without even having to take medication at all for some situations. So again, identify exposures, reduce, your exposure to it, the symptom triggers, that is. And then the medications that are over the counter, there are basically a few categories of them. There's the antihistamines, which most of them are taken by mouth, but also there's a nasal spray now that's an antihistamine. There are steroids that are taken through nasal sprays. There's decongestants. And then there's some really old medications not always available. They're called mast cell stabilizers, or cromolyn sodium's a nasal spray that's also available as well. Not as effective. And then what I really like for anybody, if they can tolerate it, is rinsing their nose with saline water. Because, I always tell people, you brush your teeth twice a day. Why aren't you cleaning your nose? Your nose is disgusting if you actually think about it. It's full of mucus, irritants, allergens, and we let that sit there. And oftentimes, yes, we blow our nose, but that doesn't always get everything out, because especially when it's dry out, it's hard because the mucus just tends to crust over and kind of keep everything in. You've got sinus pockets in your skulls that also produce fluid. And if you are getting inflammation, that's going to sit there. So you got to get that flushed out regularly to help prevent some of these symptoms from happening. And so if you do that at least at night before you go to bed, you will find a huge difference, even without having to take medication. But anytime anybody uses it, do not use plain tap water. There's a theoretical risk of getting very sick with it. There's something called Naegleria fowleri, which is often referred to as the brain-eating amoeba. So we want to avoid that, even though it's very rare, but you don't want to take that chance. And so the medications, I just want to make a couple notes about it, is that antihistamines don't treat all the symptoms of allergies. They treat mainly itching, sneezing, runny nose. The steroids are more effective, but they don't work quite as quickly and have more potential side effects that people worry about. We always are, concerned about steroids. So I want to make sure that people know that distinction. And reasons to go to see your physician is you try the over-the-counter medications, it's not working. You're having significant impacts in your quality of life. So you're not sleeping well, you're not concentrating well, you're not able to perform at work or school. You're getting sick, right? If you get a sinus infection, that's not normal, right? We want to try to prevent those from happening. So if you're getting at least one sinus infection a year, I think it's a good idea to see an allergist to try to help reduce the chances of that happening.